question is, we have to look into the iris muscles. Just concentrate on the iris muscles. We know that A is the treated eye, B is the untreated eye. और यहाँ पर और एक सिली मिस्टेक भी हो जाएगी कि आप ए मॉलिक्यूल जो है ना, ए इमेज जो है, वी वर थिंकिंग अबाउट अनट्रीटेड आई एंड बी इज द ट्रीटेड आई. Please look into that question in a detailed perspective. So here we can see there are black pigmentations. We can see black pigmentations which is there in the iris, which is not seen in the untreated eye. Which is not seen in the untreated eye. As compared to the eyes which is there untreated, the treated eye is black in color. इसको हम कहते हैं heterochroma iris. This is what we call as heterochroma iris or simply iris pigmentation भी बोल सकते हैं. तो कौन सी दवाई आपको आयरिस को पिगमेंटेशन प्रोड्यूस करने वाली दवाई क्या होगा? आपकी लैटनोप्रोस्ट. लैटनोप्रोस्ट इज दैट ड्रग व्हिच इज प्रोस्टाग्लैंडिन F2 alpha analog associated with iris pigmentation, guys. So the answer for this question is Latanoprost. ये क्या होगा सर Latanoprost? Latanoprost is a prostaglandin F2 alpha analog agent. Latanoprost is a prostaglandin F2 alpha analog agent. Currently, this is the drug of choice for the treatment of glaucoma. Especially for open angle glaucoma, this is the treatment of choice. So कौन सी glaucoma होगा सर आपकी emergency one, right? Which is going to be the emergency or which has to be treated at most or in a faster perspective. Closed angle glaucoma has to be treated. Open angle glaucoma is not an emergency. तो यहाँ पर हमने प्रोस्टाग्लैंडिन एनालॉग PGF2 अल्फा एनालॉग्स जो है लैटनोप्रोस्ट, टाफ्लोप्रोस्ट, बिमाटोप्रोस्ट हम लोग दे सकते हैं. और adverse effects of PGF2 alpha analogs are the most important ones, which has been asked recurrently on multiple different examinations. We have 4 important adverse effects, guys. First one, patients might land up blurred vision. Patients will be landing up in blurred vision. One important adverse effect of most common adverse effect is going to be blurred vision. Next, patients might land up in यहाँ पर case scenario जो है iris pigmentation हो जाएगी. That's the reason why even if a single eye is suffering from open angle glaucoma, we have to treat both the eyes. We have to administer latanoprost in both the eyes, because to prevent, one eye is going to be different color and the other eye is going to be different in color. Then it will look like a pirate. Right, and that's why we don't. It's always preferred to be given the drops in both the eyes. Then we can go with hypertrichosis. We have hypertrichosis. Increased eyelash is going to be growth. The growth of eyelash is going to be more. That is called as hypertrichosis. And most important adverse event, my dear, is macular edema. Patients might land up in macular edema. We have 4 important adverse effects associated with the latanoprost or PGF2 alpha analogs. One is blurred vision, iris pigmentation, hypertrichosis, and macular edema. This macular edema, अगर patients को हो गई, तो we have to immediately stop the therapy, guys. हम लोग ड्रग अगर जो है लैटनोप्रोस्ट उस डोज को कम करने वाले, और all these steps shouldn't be done. We have to immediately stop the therapy because it may progress on further, leading on to loss of vision. All these 4 are very much important. Here the answer is so direct, my dears. The answer for this question is latanoprost. Or what about the other options? Betaxolol is a beta blocker. Betaxolol is a beta blocker. Whereas Carboprost is also a PGF2 alpha analog agent, but it is not used for glaucoma, guys. It is used for postpartum hemorrhage. It is also a PGF2 alpha analog, but it is not used for glaucoma, used only for postpartum hemorrhage. Netarsudil is a Rho kinase inhibitor. Netarsudil is a Rho kinase inhibitor. This is also utilized for open angle glaucoma, but it will not produce this concept, guys. Instead, this will be associated with corneal verticillata बोल सकते हैं. क्या है corneal verticillata? This is a type of corneal microdeposits. There will be deposits which is there in the cornea, but it will follow a pattern of whorl-like corneal microdeposits. Well, that is associated with the Netarsudil. Here we can see the cornea is somewhat clear. We cannot see any whorl-like deposits. The answer for this question is black pigmentation of the iris, which is latanoprost.